record on this computer. All right, so good afternoon. My name is Josue, and I'm one of the group members in this assignment.
My name is Leo.
My name is Tang.
I'm Anna.
I'm Jessica.
Okay, and our topic was discussing type 2 diabetes in adults. So we wanted to further investigate on whether weight loss leads to remission in patients with type 2 diabetes.
Okay, so I'm going to introduce what type 2 diabetes is. About 245 million people have it. It's when your body can't respond to high blood sugar levels. The pancreatic cells aren't able to secrete insulin efficiently. And in a typical person, they're going to have to inject themselves with insulin. They have to take lots of medication. And before every meal, before they go to bed, every time they wake up, they're going to have to stick their finger and check their glucose levels. The life expectancy is less than a normal person, about 6 years less. And the kind of complications that they have is like nerve damage. If they get a wound, it's really slow when it heals. They have poor perfusion in their extremities. Their eyesight slowly deteriorates. They get heart disease, get kidney problems, and they start losing their hearing. And then, so now we're going to talk about remission. So remission is kind of their body coming back to normal. So they're going to take 2 blood draws of a hemoglobin A1C that are 26 weeks apart. And the result should be less than 6.5%. And then they can't be on any oral diabetic medications when they're doing these tests. And then out of the total population of diabetes around the world, only 5% are in remission right now. So then this is going to bring us to our PICO question, which is in obese patients with type 2 diabetes, can weight loss compared with no weight loss lead to diabetes remission? So our population is diabetic patients, type 2, intervention, weight loss, comparison, no weight loss, outcome, remission. And then the importance of this is we want to increase the amount of people in remission. Why? Because it's going to increase their life expectancy and they're going to get a better quality of life with less health problems.
So what we ended up doing as a group is that we did some research. We collected articles. These articles that were done in different places. For example, some of them were in the United Kingdom. The group size of the studies depended. Some had larger groups, some had smaller groups, but the overall concept was, again, following these patients using a prospective study. I think the average was about 4 years. So these studies, again, follow these patients over a certain amount of time, and they wanted to see whether the weight loss supported the idea of the patients managing or going under remission. So I think about 2 slides back, we defined remission with a decrease in HbA1c. A little bit more info is that one of the studies actually included exercising, including changing the diet, and my study even included weight loss surgery. Again, a lot of these articles did show or did support that losing weight does lead to some type of remission of type 2 diabetes.
So just synthesizing all of our results here, we had weight loss as part of our main intervention group in all of our studies. Like Jose just talked about, some of the methods varied across the board with our studies. Some involved surgery, while others just involved diet, exercise, or structured weight loss programs. As Anna and Jose talked about, remission was often defined as a hemoglobin H1C less than 6.5%, going off 2 months without any type of diabetic medication. So all 5 of our studies actually concluded that weight loss did play a significant role in leading to diabetic remission with our patients who had type 2 diabetes. Here we can see the different methods in which each article went about achieving diabetic remission, such as Article 1 that did the surgery with gastric bypass. Article 2 showed that more than 10% of body weight loss was likely to achieve remission at the 1-year follow-up. Article 3 with lean showed that weight loss management programs were effective in achieving diabetic remission. And then the next article showed just exercise and general weight loss that showed highest chances of diabetic remission. And lastly, Article 5 showed that just a significant weight loss with some structured programs led to diabetic remission in adults. And just touching on some of the strengths and limitations within our studies. So some of the strengths involved the large sample size, and these were highly representative of our general population. The consistency of the results we had across our studies showed reliability. Many of our studies had an exclusion criterion, and this helped avoid certain variables that would counteract what we were trying to achieve, such as like cancer and pregnant women. And different studies had different follow-up segments in which they would look for diabetic remission at different timeframes. Some limitations, on the other hand, included the inability to include such follow-up segments. Like Jose mentioned, one study was done in the UK, and because it was done in the UK, this left out certain ethnic and racial groups. So that wasn't able to be consistent with the general population. And a couple studies had a sample size that was small. So as we can see, some of these articles had different variables that made up for another article. So we kind of have equal amounts of information.
So the overall clinical implications did indicate that with weight loss, diabetes type 2 can go into remission. So I know we already reviewed the different types of ways that weight loss was achieved. So surgical interventions through the laparoscopic gastric bypass. We had weight loss with the structured weight loss programs and the diet, and then we had the exercise leading to weight loss, and all those did eventually lead to the remission of diabetes type 2. So as a BSN nurse, it's important that we understand that with weight loss, no matter the route, an individual can achieve diabetes type 2 remission.
Overall, we can see some evidence that weight loss in obese patients with type 2 diabetes can lead to diabetes remission when compared to no weight loss. We have 5 out of 5 articles support it is beneficial to lose weight when diagnosed with diabetes type 2. And this article encouraged and promoted weight management. Also, despite some support, and we can see some limitation, like for article number 1, we can find that only small number of sample size were able to lose 10% of their weight. And for article number 2, we found that individuals with type 2 diabetes early who can become pregnant was excluded. And for article number 3, we found that limitation of this study included the racial and ethnic characteristics. And article number 4 found that the study had short follow-up a period of time. And the last one, we can see a few participants and lack of control group. all the limitations highlight the need for further research to be conducted, even though this was limitation among 5 articles. Most articles favor the waste management program and predict the benefit in long term for controlling diabetes. Weight loss not only beneficial for diabetes, but also help reduce the risk for cardiovascular disease.
So once again, so our topic again was type 2 diabetes and whether to highlight or support if weight loss leads to remission. And again, like Tang mentioned, just to summarize, our articles did show that it ended up showing that through a decrease in A1C over a certain amount of time through the prospective study. So thank you for the opportunity. Again, my name is Josue and I got the rest of the group. Thank you, Dr. Asma. All right, we'll be concluding the video now. Summarize that.